Nice to see you again. We want to talk today about a question that a lot of patients come in with. Sometimes you're pretty happy with your nose. It's not really an aesthetic issue at all, but you find out that you've got a deviated nasal septum. And the question is, who should do that septoplasty and how is it done?
So septoplasty is done very often by ENT facial plastic surgeons like us, where we're really dealing with breathing issues with the nose. Sometimes a deviated septum, if it's severe enough or in a location up high or down towards the tip of the nose, can also cause the nose to look crooked, and that can be done as well to help straighten the nose cosmetically. But for a lot of patients, we do it just for breathing functional reasons.
Absolutely. So within that, primarily most surgeons at that point are going to go through an internal incision. There's no external incisions in 95% of those cases. There's the occasional patient where the deviation is very anterior or so severe that you really do get a better result if you do an open approach.
And essentially what's done with the septoplasty is we're straightening the septum itself. The septum is made up of bone at the back, cartilage at the front, and that's the main foundation for the central portion of the nose and for the tip. When the septum's deviated, it's very often pushed off the normal bony channel that it sits on, or there may be a large spur or a large projection of bone or cartilage that's pushing into the airway and causing obstruction, and that's what we want to fix.
The key here is really when does it make sense for a facial plastic surgeon such as us to approach it. Oftentimes when you're going to just a run-of-the-mill general ENT, the general dogma we were instructed when we were in training is that as long as you take the sort of essential portion of the cartilage out, that's the main portion of the airway, and as long as you deal with that part of the septum, then you're going to be okay. But after you've done a couple of thousand noses, you come to realize that's not necessarily true.
So if you have a septal deviation that's up high or that's more anterior towards the front of your nose, and that's not dealt with during the septoplasty, you're not going to find your breathing is really as good as it can be. And so that's something that we would deal with during your surgery to make your breathing as good as possible and at the same time straighten the nose and deal with any cosmetic issues.